Hello, everybody. Change of plans. I will be going to Encompass for the next 2 days, which is Monday and Tuesday. Our class finishes within this week, so I thought it was only fair to me do a video and record it, and so you guys can review a little bit on your chapters. Okay, we started with chapter 11. We didn't finish it up because of our time last time, but remember on with the EMR system is chapter 12, so we need to learn on chapter 11 how to document. Remember our SOAP technique and remember our cheddar technique. Read about those two documentations, what the SOAP stands for and what cheddar stands for, okay? They're in chapter 11. And these two techniques will help you how to document on the patient's chart and actually have a complete documentation within these charts. Okay, so the C's of charting is client's words, so that means you don't change what the patient told you, what they're coming in for the office. You actually type in whatever the patients gave you as a chief complaint. Okay, clarity, use your precise description. Completeness, don't leave any blanks. Okay, for example, if you have questions to be asked, answer them. Don't skip a question or skip a column. Okay, go down the line and answer every single little line that you're supposed to be asking. Conciseness, it's like the clarity. Okay, so don't change the wording. Make it a habit of always completing scenarios down the line instead of keeping around with little spaces. So chronological order, same thing. If the doctor wants you to document your patient's visit for today on top, then you go like that. Okay, don't put today's visit on top and then he's expecting it on the bottom. So depends on how he wants it. So you go ahead and document that visits for today. Okay. Let's see. So that's a little review on chapter 11, what we have not covered. Let's go to chapter 12. Okay. I have my book here with me, so that way I won't skip a thing. Okay. It's electronic health records. The electronic medical records, it's EMR system. Okay. It starts within page 251, and it says that it's health related information. How you created a paper chart, it's the same way as we create a health record. Okay. Nothing changes. The only fact that there's no paper, everything's on the computer. Once you enter things in the computer and you want to delete stuff and it's already signed by the doctor, which means finalized, then there's no way you can change information on the chart. You can't go back and delete unless the doctor has told you to, but you won't be able to delete the information. You're going to have to build what it's called addendum. And most of the time, the addendums are done by the practitioner, okay, which is the doctor. Okay. The other one is the electronic health record. These are provided within the correct system. Will have access to patients' information no matter where the information is organized. Okay, so there's multiple users on the EHR. The EMR, it's only in the office setting. Only one person can access it. Different people from the office can access the EMR system, but patient chart. But that doesn't mean that somebody from another facility can actually access that EMR. With the EHR, another person from another facility can actually access this chart. Okay, so that's a different one. So these are many provided with an incorporated EHR systems will have access to patients' information no matter where the information organized. They will be increased patient continuity of care, reduction in medical errors, and you ultimately decrease healthcare costs. Okay, and also helps out with lab work. That way, one provider that if a patient has two providers, one specialty and one primary doctor, and they want to prescribe him something, they both won't have to be able to prescribe the same thing. Or if they want to order a lab, they won't actually order the same lab twice. So that also helps with the continuity care. Okay, the PHR, which is your personal health care record, that is built by the patient, and the patient updates all the information by themselves. For example, insurance changes, phone number changes, dependent changes. So with the PHR, the physician is able to see what changes have the patient done prior to going into the office. So Know the difference between all three, okay? It is the EMR system, which is the electronic record. That is the one that you use in the clinic or in the office or wherever your facility is working. The EHR is the one that a multiple user can actually use it, okay, at the same time. And the PHR is done by the patient, okay? There's another vocabulary word that it's called meaningful use. Meaningful use means that you are going to be using your software as much as 100%. Okay, you have audits, and sometimes those audits will come in and say, you know what, you're documenting okay, but you have not been using all the software that you're supposed to be using. Okay, so meaningful use means that you have to use 100% of your software. If you're doing a checkup, let's say a whole physical, you have to go through ENT, so all the body sections, okay, head, nose, eyes, ears, and your throat. Okay, your ENT will check all that. So meaningful use meant that he actually checked all things and he documented on the patient's EMR system or EHR system, depending on what they're using. Okay, let's see. Let's go a little bit further down. Advantages of the EHR. Advantages is that fewer lost medical records. I mean that you can't be looking for a paper chart. And if, for example, if you have the chart with you here in your hands, and let's say that coding system needs the chart, and they go and look for it on the file cabinet, they won't find it. Why? Because you're here, you have it here, but they don't ask you, and you put it under another chart, and this chart gets lost. So that's something that the EMR system has as the EHR system has as an advantage. Okay, you don't have to go look for a physical chart. Okay, increase readability, legibility charts. So as you can see, you type everything, so you don't have to actually read anything that somebody wrote. And believe me, my handwriting is not the best. Okay, easy access charts with multiple users. So like I said, I can be using the chart. The coding department can be using the chart. Registration can be using the chart just in case they need to make an appointment. So multiple people can actually use that chart. Versus this one, only I can use it because I hold the physical chart. And if someone else needs it, they need to come and ask for it from me, and then they take it. So I can't work on it no more because I don't have the chart. Okay. Increased access to patient education materials. Like I say, your software has a lot of patient education. So those of you that used to be doing pamphlets, scripts, or things like that for your patient education websites, your software will actually have all that information integrated into your system, and it's easier for you. Okay, decreased duplication of test orders. Like I say, if one provider sends us to do a CBC, and then your primary doctor sends you to do a CBC, your software says, hey, there's already been one CBC order. You don't have to be doing 2 lab works for the same thing. Okay, let's go with some disadvantages and then read on. Okay, I haven't done all of them. Disadvantages is that you have to, it's costly. Okay, you have to hire an IT department. You have to train the staff, and it's like about $44,000 for a full-time practitioner. So $44,000, it's a lot. Okay. So many in the minimum cost of maintaining this software, like updates and whatever things they need to be doing to make sure that the software is working, it's about $8,500. So as you can see, it is pricey to have an EHR versus a paper chart, but you have a lot of advantages towards that. Okay, sometimes you even save from one MA doing 2 things. That extra MA can actually be doing another thing because of the EHR system advantages that create a lot of shortcuts for you, and creates a lot of less time wasting in the work area. Okay, let's see what else we got to. So creating new patient records, it's like same thing as paper chart. You're gonna have all the registration forms filled out by your patient. A lot of practices have done is that they have put a little tablet on the front of the office with registration, and they type in all the information. That way they don't have to scan any papers. So that information goes directly to their paper chart. I'm sorry, the EHR system, and that way they don't have to be shredding or scanning papers. But a lot of people don't do that yet, so they still fill out those papers. Then the front office person types in all the information on the patient chart, and that's created by the registration. Okay. Now remember, once you create those registrations, make sure that you actually shred those. Okay, because that's a lot of information that your patient is giving you for you to just throw in the trash. So that you always shred everything. Okay. A face sheet is something that is provided by either by the doctor that goes to do his hospital rounds, and you don't know that how many patients he saw over there. So the hospital gives him a face sheet. Okay, this face sheet is it's like a super bill, and that's how you're going to do. You need that paper in order to charge the doctor's rounds visits. Okay, and like I say, those will be provided by to the provider, and the provider brings them to you. Tickler fires, that's something that you can actually use, but the only reason that helps is if you check it every day. It's a system where you put your notes like reminders. So once you do that, you actually have to be checking every day in order to work. So I really don't use that, but a lot of people do. Electronic schedulers, billing coding software systems, eligibility verification information, those are all stuff that you need to learn. Once you go into SimSchart, you will be doing some patient eligibility for insurances. You will be doing some electronic scheduling. So you'll see how a schedule is done. It's very easy. Okay. All this software, those are all templates that are associated with your practice. So you're gonna have stuff that it's associated to pediatrics, gastroenterologists, I couldn't get the word, cardiologist. Okay, so those are things that you actually have to know, that the software that you buy has to go with what the practice that you're using. You can't be buying cardiologist software for a pediatric office use. Okay, so those are things that you have to keep in mind when you're buying a software. All right, that covers chapter 12, guys. So just to emphasize this, is remember the difference between EHR, EMR, and PHI. Those are the main things that you need to learn from this chapter. The schedule system, like I say, you get good practice on SimSchart, so make sure that you start doing your SimScharts, because in that place, in that software, you're actually using an EHR system, an EMR system, a PHI system. Okay, so make sure you use your Sims. Pay attention to your Sims, because that's what these 3 chapters talk to you about. We covered a little bit on these schedule systems, so you know a little bit now from how to either do a booking appointment or a waive a pay schedule system. So it depends on what system that they're using. So, but you're already aware of those different schedule systems that are out there. Okay. If you guys have any questions regarding these 3 chapters, please make sure that you write them down on the discussion board. I will answer your question as soon as I get home. Sorry about the inconvenience of changing the days, but we had to change some days because there's too many people on campus, and we can't have too many people on campus. So I'm doing Mondays and Tuesdays from now on, and then I'll keep you in touch, updated with whatever changes are out there. This class finishes this week, so I will be posting some quizzes. Those of you that couldn't open the quiz from Thursday, I'll go ahead and do a second quiz, which will be quiz B, and you can go ahead and log into that one. Those that did were able to log into the quiz on Thursday. You don't have to do quiz B, okay? But it's up to you if you want to practice another one. Alrighty, so any questions, guys, like I say, make sure that you write them down on the discussion forum, and we'll go from there. Okay. All right, guys, don't drink and drive. Have a good one.